just to go back in terms of what is border control, we've seen that over the years around the world that the traditional role of customs has been dwindling. Customs is primarily a revenue generator. Things like the single window, changes at the airport, in terms of people only carrying a 50-pound bag, new technologies have really changed that role of customs. We also have immigration officers. I think it's something like 80 of them, which are policemen. And you have to beg the question, why would you have a person who's actually a trained police person sitting there stamping passports? And so the goal here is to be able to strengthen our borders. And we're looking at integrating a couple of our agencies. So one is immigration, two is customs, the other one is the quarantine, and the third one is the marine police. So the new border control would actually be those four entities merging into one. And I have no idea where the idea of a statutory body came from. Security is of a national interest and will remain under the control of the state. There is nothing envisioned that anybody is being dislocated or sent anywhere else. The police officers will no longer be performing the function of immigration. So the police officers will now go back to the substantive post on the beat, which we're very excited about because we would like to see more policemen on the road. And I would have liked that to have happened already. But given the lack of software systems, we've not been able to do that. And I'll talk about that a little bit later. Customs now would really be taking on the role of immigration, also integrating the quarantine, and really the people who are part of the Marine Police will now all have the same status. So if anything, Customs is being upgraded, not downgraded. We don't see anybody being sent home. And where the program is right now is that we had a committee, representative of the different agencies working collectively together that made a presentation to Cabinet. In fact, only last week, the decision to proceed with the transitional committee was made. So the transitional committee now's responsibility is to work with all the different agencies and informing them as to what's going to be taking place, how it's going to be affecting anybody, if anything at all, the new training requirements, the new regulatory requirements in terms of creating this entity. So I don't know how and who would have been the person to have gone out and made these allegations, but I'm grateful for the opportunity to be able to clarify them. What's also very interesting is that the software that we've been using at the border has been dysfunctional for years. So in fact, when people are coming in, we're back to the days of where immigration officer is looking at you, looking at the passport, looking at you, and looking at a passport. So with the passing recently in the House of the Advanced Passenger Information System, which will allow us now to upgrade to a new software system. The company came in. I'm hoping that we could move very, very quickly to get that new system in place, which would mean that solutions no longer will need to fill out the immigration cards when they're coming in, and that people would have actually been checked before they even arrived in St. Lucia by using the different security systems around the world. So that's where we are with the border control. I don't know if there's any clarification anybody would like.
I just want you said that you don't see anybody being sent home. Are you making a commitment to everybody that's currently working in customs or whatever that they will not be asked to resign?
My government, since we've been in office, has not asked anybody to resign. Okay, so any solutions that require people to be sent home is not something that my government would consider. And so categorically, I know of no proposal that has suggested that anybody would have to go home. And also just common sense will tell you if you're adding more responsibilities, I don't know how you would end up hiring less people.
Okay, let's take a question from...
Well, no, she just want to finish it.
Oh, you have a follow-up?
No, he's
okay.
not done.
Okay, sorry.
So can we just ask that the members of the transitional committee be released to us at some point in time?
Sure, because part of their responsibility is the communication strategy for this, so they'll be doing that. With regards to OKU, I mean, work continues. along the same line that we've been talking and articulating the entire time. It is no secret that the government has been in discussions with Cayman Health City. Cayman Health City have been the only entity that have made a proposal to do a JV with the government. Everybody else who has come to the table wants to do a management contract. We've also indicated that the government realized long before that we'd met Cayman Health City that if we wanted to fundamentally change the access that people have to health, if we want to also make healthcare more sustainable over a longer period of time, that we felt the introduction of a healthcare insurance policy would be the best way to go. Because a healthcare insurance policy ensures that the doctors, the primary healthcare services, the healthcare centers, whenever there is a charge, that charge will be, in most part, taken up by the insurance. So it means that there's a revenue stream generated for the level of activity, whether it's Tapia, whether it's Victoria, whether it's St. Jude, whether it's Doctor. So the healthcare insurance was not thought of in order to support Cayman Health City. It was there because we realized if we were going to bring anybody to the table, it works better for everybody from that perspective. So Cayman Health City is made an initial proposal to us in which we're now finalizing the terms of reference for that agreement. And they came down with a very senior team here and have made some basic proposals to us. And one of them is the understanding, what is OKEU? Is OKU going to be a secondary level hospital, meaning that all the services that currently exist at Victoria and how we run Victoria would literally be transferred over to OKU? So it's difficult to say that that was ever the plan because you have 170 beds at Victoria and you only have 120 beds at OKEU. So it meant that there was some kind of change that people were anticipating. So there needs to be more secondary beds to make up for if you close down Victoria. So where are you going to fit the 170 beds? Now, some of them may end up going to OKEU. So are you going to keep Victoria open? So you see what I'm saying, what I've been saying from day one, is that the cost implications for opening up OKU are significant. Because what has been said is that just to open up OKU and operate it is $70 million. And that's above and beyond what we're currently doing. And you remember the assumption, and that's why it's important to, if you go back and listen to the presentations that I've made, the assumption all along has been that Victoria would be shut down. So the $35 million that you're paying to run Victoria would be used to cut down the operating cost at OKU. But how do you shut down Victoria when it's 170 beds and you're only moving into 120 beds? But more importantly, what I want everybody to hopefully realize is that the cost of now maintaining a bed at OKU is going to be 4 to 5 times more expensive than operating a basic bed at Victoria. So not only are you going to get less beds, but now the cost is going up. So the proposal is to look at OKU specifically as a tertiary level healthcare system. So providing services that currently don't exist in St. Lucia. So when St. Lucians need certain procedures, we have to either go to Martinique. So let me give you an example. An MRI for your head. A simple thing like that, we have to leave. And we either got to go to Barbados, we got to go to Trinidad, or some people have to go as far abroad as Martinique or Miami. So the goal is to have a facility here that can provide those services. Now, the reality is that St. Lucia's population cannot sustain a tertiary level hospital by itself. And I go back to a conversation that I had when I was in opposition with Canadians, where they said to me, "What's your population?" I said 170,000. They said, "That's a town in Canada." Okay? There's no town in Canada that is self-sufficient in medical services. So what would happen is you have basically a secondary level hospital in the town, but everybody goes to the cities or to specialized places to get their services. So the only way that St. Lucia now can be in a position to afford now to have a tertiary level hospital in St. Lucia is through medical tourism. Can we do it where we can provide high enough quality tertiary level services at a globally competitive price that people, instead of going to Miami or to some other places, would come to St. Lucia instead? That's the question. That's really what we need to be able to make. And if the answer is we don't believe that that's the case, then it means that we now have to find a way to cover the additional cost of moving Victoria into OKU, which is going to be extremely expensive because there's no other revenue streams to be generated to make up for that additional cost. So the Cayman Health City have made a proposal to us to look at converting or upgrading OKU to a tertiary level facility. Obviously, outpatient services are already there and will continue to be in that location. And meanwhile, to dust off all the plans as to how the former government and former governments, I don't want to categorize it to one, we're planning on dealing now with the integration of OKU into our system. So we are in the process of building a new mini hospital in Soufriere. Should we now add more beds? We're building a polyclinic in Dennery. Should we upgrade that to a mini hospital and add some beds? And I will be announcing very soon the plans for St. Jude's, where we're proposing to do at least minimum 70 to 100 beds. So if you take Vieux Fort, Dennery, Soufriere, and whatever is our new Victoria Hospital in this location, that needs to add up to more beds than what we currently have at Victoria. So in terms of Victoria, we have several options. Okay, you have a mental and wellness facility that is grossly underutilized. If we're saying 20% of the building is occupied, that would be, I think, an exaggeration. So the question comes, should we look at the possibility of upgrading the mental wellness to, for no better name, a new Victoria? And so that you have now those additional beds. We believe we can put at least 100 beds into that facility. But I just want to say to you that I'm being very open, very transparent. None of these decisions that I'm speaking about has any decision been made. These are preliminary discussions of different options and different scenarios that we have to weigh up. And that's why it's important to be able to get a proposal from the Cayman Health City that we understand what our options are. We're actually looking at both those options. St. Lucia's passport is actually pretty good. It's a readable, barcode readable. What it does not include is what we call biometrics. So a lot of new passports now have a very smart option in it, which includes fingerprinting, retina, depending on the different technologies that people have. So we are looking at, as one of the options, to upgrade to it. So if you've seen like the European passport or the US passport, when you open it up, the identification page is almost like glass. You know, it's like a hard plastic. That's where the chip is, which makes it much more readable, but more importantly, much more difficult to be able to counterfeit.